Have any of you been to the hospital or nursing home or adult family home and have seen somebody who has a sign up above their room, their bed, on their door, on their chart? It's going to be in the computer, and it might even be on their wristband. And it's going to say fall risk or falls risk. Either one works, and each of those are interchangeable. What does that mean when you visit somebody and you see a sign that says fall risk? It's alerting everybody that this person is unstable, that they've already maybe had a fall, that they're on medication that's making them unstable, that they had surgery that made them unstable, and that we have to pay extra attention to make sure that that person, young or old, does not fall again, to the best of our ability. As always, resources, statistics, everything that I'm talking about, and some really good resources about how to prevent falls is going to be below in the description box. But at this point in America, 1 in 4 older adults falls. And once you've had one fall, your chances of having another doubles. Millions of older adults, age 65 and older, fall, and many of those individuals die as a result of the fall. So that's why falls are so devastating. They delay healing, they have secondary and tertiary implications and causes for more harm to that individual. The worst thing being death. Let's go over some stats here. 1 out of 10 falls results in an injury that causes that older adult, remember 65 and older, to restrict their activities for a day or more and seek attention from the healthcare system. Another thing to keep in mind is that a lot of people don't report their fall. They don't tell their family, and you go to visit them and you see that they've got bruises or they're limping, they have some kind of injury, and nobody knows what in the world happened. But that person more than likely has bumped themselves very hard to cause an injury or has fallen, and it's not reported. Each year, over 3 million emergency room visits are due to falls in older adults. Each year, there are about 1 million fall-related hospitalizations. Each year, nearly 320,000 older adults are hospitalized due to hip fractures. These hip fractures are occurring as the main reason due to their fall. Also remember that falls are not always so graceful in older adults, and head injuries are something that does occur, and again, that's another reason for secondary problems and possible death. So why are older adults falling? Tripping on rugs that are around the house. We think they look so nice, and they do, and sometimes we even think that they're going to help prevent a fall by having a little more stability underneath that person's foot, but actually it does the opposite. So if somebody comes into your home like OT or PT, for example, they're going to make sure that they discuss getting rid of those rugs, even in the bathroom. So that's a whole nother story about safety in the bathroom. But having rugs scattered, I'm talking about those that are scattered all over the home, are very dangerous. As people get older, their muscles aren't quite as strong. Their ability and reflexes to catch themselves when they're falling is lessened as they get older. So why are they falling? They're falling due to losing their balance, vitamin D deficiency, osteoporosis, lack of strength in the lower body. Some individuals are weaker as they get older. Some do not get their cataracts taken care of, or they have old glasses. They're not able to see as well. Again, back to tripping on things. It doesn't have to be a rug. It can be anything. And these are reasons, just some of many, including maybe medications that are making that person dizzy. There's a lot of medications that make fall risk increase in an individual. So once this fall has occurred, secondary problems are now possibly going to happen to that older adult. If they have a fracture, they're going to go in for surgery. Surgery has its own complications. Are they recovering from surgery? Okay, maybe they have to recover at a rehab center and they're not eating as well. They become depressed. They're not going to participate in the things that they need to do to get strong again, such as physical therapy and strength training exercises. They have a fear of falling again, or a difficulty in using a cane or a walker. These are, again, just some reasons of many that people go downhill once they have had a fall. Some other reasons that people don't do well is they go in and have the surgery, for example, but then they have infection. They have a complication. They just don't get better. And then they give up on life. And if you have seen anybody give up, it's a real thing and it's very sad. But they are past the point of feeling that they can get better. They continue to decline. They're not improving. Months have gone by, and all of this was a result of a fall. Some other issues that can occur after a fall that then continues on down the path of non-healing and then possibly death are blood clots, pneumonia, depression, like I mentioned, lack of support at home, or they don't have anybody to take them to their follow-up appointments or their physical therapy appointment or encourage them. They might refuse to have people come into their home to help them with any of these sorts of things. They might have cognitive issues like dementia or confusion. So those of you who follow my story about my mother who has Alzheimer's, this is a typical example. So she has fallen now in the past about 18 months, I guess, maybe 2 full years, 6 different times. She had no falls, not even tripping, all the way up until that particular point, and then now falling is happening very easily. She always forgets to take her cane. She forgets to use her walker. She continues to think that she's 25 and that she has no mobility problems. She forgets what the physical therapist has taught her. Somebody cannot be with a person one-on-one. Well, I guess they can if you hire them, right? So money talks. So if you have money, you can hire somebody to be with your loved one one-on-one. Have different people come in for different shifts. And they're going to keep an eye on that person to make sure they're not falling, to make sure they're doing their physical therapy, strengthening, make sure they're on a really good nutritious diet for healing. But is that the reality of life? It's really not the reality of life, including my mother, where I'm there all the time and she does have a caregiver that comes in 2 days a week. But we're not there 24 hours a day, so falls do happen. And often when that person with cognitive decline does fall, they don't have any memory of falling. They don't know how they fell. They can't give you any kind of report on what occurred. You either find them like that or you find them injured. Statistics say that 1 in 5 older adults, 65 and older, who falls will pass away within 1 year. That's really alarming. And another example is this lovely lady here that I'm going to put probably somewhere over here. And I've known her for many years, and she's my mother's neighbor, and she fell. She was only in her 70s. This lovely lady was very active and healthy and funny, witty. We've had many long conversations and lots of lunches outside together over the years that I knew her. But it was something very simple. She was walking into her apartment. She opened up her door and she just tripped a little bit, but she fell backwards. She broke her hip, femur area. She had surgery. From surgery, she went into rehab. She finally got to go home. Then she went back to the hospital for an infection for MRSA, then back to rehab. Okay, this is a really common occurrence. And this is with somebody who is cognitively intact and who knows about not putting rugs out and all that other good stuff. But it can happen to anybody. These things happen. She even has an extremely supportive family. Is just a lovely lady. But after back and forth and one infection and one surgery after another, this lovely friend of mine decided that she did not want to continue doing this and was very tired. Would we call it giving up? You know, you can call it whatever you want, but it was something that she decided. She then went into hospice and she passed away. You all probably know somebody that this has happened to, and if you don't, you're maybe going to encounter that situation later on in your life. But these statistics are pretty bleak. So 1 in 4 falls that we know of, other people lay and we don't get a chance to help them. So they finally get themselves up or somebody discovers them and this never gets reported. So at least we know it's 1 in 4. And then from there, complications can arise. And from there, 1 in 5 individuals pass away from complications from that fall. Okay, so what can we do about this? What can we do about these falls when somebody can't be hanging on to that person 24 hours a day, watching them, taking care of them? Well, like I said, get rid of clutter. Here's what we can do that we know would help. Get rid of those rugs. If somebody is unstable, they need somebody to help them getting in and out of the shower. If they're taking showers, they need a shower chair or shower bench. Bathtub time might be over when you are an elderly person. It is extremely difficult and risky to be standing up and going down into a bathtub full of water, and you need somebody to support you or 2 people to support you for that kind of a thing. Install grab bars into many areas of your house, the bathroom especially. Good lighting is really critical. Non-slip shoes, non-slip slippers, the kind that have the grip on the bottom. Review medications and see which ones might be causing dizziness or falls risk. Getting your vision checked on a regular basis, wearing the glasses that you should be wearing, and getting cataract surgery if it is advised. Another good thing is learning how to get back up if a fall occurs. I know that physical therapy taught my mom that. over the years. And there is a special thing that they can do for these people to help them wherever they live. They come into the home and they show them, if you fall, here's what I want you to do. But of course, if a person has declined cognitively, they're not even going to remember that appointment. So if a fall occurs, learning how to get up properly and hoping that you're not going to break a bone when that fall or if that fall happens. So that is key as well, because again, once the bone is broken, the femur, the hip, anywhere in the pelvis, the back. I even knew a lady that my mom used to play bridge with who fell and broke her neck. So that's how she lived the last part of her life, was with a broken neck in her late 80s due to a fall. So if a fall occurs, you want to try to eliminate a fracture, eliminate hospitalization and other complications that might come down, and for sure to eliminate death. I hope that this was helpful. I hope that the biggest thing is that people understand why falls are so dangerous and why people who've seen people die from a fall are so completely freaked out about it. Like, get rid of that rug, please don't fall, please be careful, please use your walker, over and over again, putting signs up. Screaming down the street. Let's hope it's all in fun. Let's hope they're just having fun. But yeah, we, especially medical people, when we know that somebody has fallen or is at risk for falling, we do everything we can to eliminate that from happening, because we know the consequences of a fall, that it often means death. I hope this was helpful. I hope it helps somebody out there who's got a loved one who's a fall risk. Pass this along, give it a thumbs up, share it with somebody that it might be beneficial to, and please consider subscribing. All of the content is related to health, happiness, peace inside us, joy. And if you have any thoughts or ideas on a topic, that a myth or fact that you would like to be covered, please put it below in the comments. Have a good day.